So on the referrals, speaking to that situation with Advantage plans, one of the things that people, I think, a lot of times make a mistake on when they're getting an Advantage plan, they first check to see if their doctor's in the network, which is all fine and dandy, the doctor's in the network. But now something for now, right? And they can drop out anytime. That's the whole thing. They don't have to wait all year like you do to get off of an Advantage plan. But they'll check to see if the doctor's in the network, and perhaps he is, but then a health condition will come along, and now the doctor is not in the network that they need to see. And that creates they have to go to their primary, get a referral, and find somebody. I had somebody just within the last year that the daughter called me, speaking of which, and the mother had always had a Medicare supplement. Actually, we helped her, so I know this person personally, had it for years and years and years. And she was like 82 or 3, somewhere in that neighborhood. Very healthy, with the exception she had macular degeneration, and it was a wet macular degeneration, so it required injections in her eyes, and that's all she had. And so in the mom's mind, oh, I'm very healthy, not even understanding how much those injections cost, but she thought I could save a lot of money, saw one of those little commercials at the end of the year and decided to get on a Medicare Advantage plan, and did it without the daughter knowing. The mother lived by herself, so she did not have any kind of assistance making her decisions. She was very bright and can handle her own affairs, but the daughter, because of the mother's condition with the eyes, is who always took her to the doctor. Well, she changed, got one of those plans, and I'm speaking about the referrals, got on one of those plans, perfectly wonderful, healthy. She goes, now this was in October, in December is when she has her annual checkup every year. And when she went in for her checkup, they diagnosed her with cancer, lymphoma cancer. So now the daughter, not knowing she changed plans, does as she's always done if her mother had to go to the doctor, schedules an appointment with a specialist that was supposed to be one of the top specialists to go see for right after the first of the year, because this was right before Christmas. She goes to the doctor with her mother, drives her there, and the first thing they say is, oh, I'm sorry, we don't take this plan. And so the daughter was a little shocked and said, no, my mother's able to go to any doctor or hospital, because she thought she had a Medicare supplement. And they said, no, it appears, and I won't mention the plan, but it appears that your mother has got enrolled into a Medicare replacement plan, because an Advantage plan is called a replacement to Medicare because it replaces your Medicare from being your primary. And so step number 1 is they sent her home. Now she gets a referral, and I know this for a fact because I spoke with her. It took 6 weeks, not 2 days, not 3 days. Now keep in mind, she has cancer. She's 83 or 4. You want to get a course of treatment going. 6 weeks to get one name. It wasn't like, okay, here's the top 10, pick who you want, who you're comfortable with. One name. And this one particular name was 60 miles. And so they drive 60 miles, and this true story, this is unbelievable, really, it's almost unbelievable. But they drive 60 miles, they get there, the person at the front, very sweet, very kind, said, I'm so sorry we can't see your mother today. The daughter was a little bit beyond upset and said, listen, we've waited 6 weeks to get a referral. I just drove 60 miles to get here. The plan told us that you were in the network. They were very, very apologetic. They explained, yes, we are in the network, but we too had to wait for release to be able to see you. We haven't got the release from the Advantage plan yet. They had to send her home again. Now, this is what I refer to as a disadvantage, emotionally, mentally, health-wise, physically. And so I know the importance, myself personally, how important it is to be able to see whatever doctor or hospital if you come up with any kind of situation health-wise, but it is imperative people understand that getting a referral it can be very critical if it's right on the brink of a situation that's life or death. It definitely can be traumatizing mentally waiting for that. I mean, I can personally speak to that because last year, at the end of last year, I had a health condition come up. Now, keep in mind, I just want people to understand the importance of having good care when you need it. We are not carrying insurance because we need it. We're carrying insurance in the event something changes and we need it. We're protected with our finances, with our emotions, with our peace of mind. But I am somebody who has taken care of myself my whole entire life. I'm very health conscious. I'm a total health nut, you might say. I started out very young at 16 being a gymnast and always very conscious of what I ate. And my husband and I both are big workout advocates and I work out 4 days a week. He works out like 6 days a week. Takes 0 prescriptions. Just very, very healthy. But the end of last year, I had a situation come up where I had a 10-centimeter tumor that covered my kidney. It was malignant, and I had to have my kidney removed. Now, I'm going to tell you, after 34 years of being here and doing what I do, there was a whole another level of impact of what it means to people when they're able to have peace of mind that they're getting the best or they can go the best. If I would have had to wait for 6 weeks wondering what in the world I'm going to do, how am I going to do it? Now, just to say this to everybody listening, I am wonderful 100%. I had truly one of the top surgeons in the United States. That's the ability to be able to choose who you want. I am 100% cancer-free. They removed my kidney, removed my adrenal gland, but I'm just saying it's important to have peace of mind. Originally, when I was told this, and people may think, well, it doesn't matter. I'm going to tell you it matters. Because when I originally was told I was going to have this done, the first surgeon, who is also excellent, was going to split me from the middle of underneath my breast all the way through my belly button and 5 inches below. That's a pretty good incision. And there was a 6-month recovery time, a 6-day hospital stay, and it was going to be, his words, a pretty brutal surgery. But just long story very short, peace of mind of being able to go anywhere you want, being able to have the best and not worry about it. If people are on Medicare Supplements, I was able, and I mean at the last moment, truly the last moment, the night before my surgery, I canceled it and found a surgeon that went in robotically. I had, instead of like a 32-inch incision, a 4.5 to 5-inch incision. Instead of being in the hospital 6 days, I stayed overnight. Instead of a 6-month recovery, I went in on a Thursday and went back to work on Monday. That is something a lot of people on Advantage plans don't understand. They don't understand that they could recover quicker, they could be out quicker, they could have, a lot of people can't get the help because they can't get the right connection to the right doctors to have the best. So I'm telling you, it's important to be able to go not only to who you want to go, but when you need to go. It's vitally important.